Okay, so we are very lucky tonight to have Dr. Margaret Bojko from Wisconsin Equine. She, like me, went to the University of Illinois to get her Doctor of Veterinary Medicine. She's a 2016 grad. The next year she went to Allegheny Equine, and that's in Pennsylvania. And I think I know the practice owner. Is that Jim Ziliff?
Yep, Jim Ziliff.
Okay. And then now that she's at Wisconsin Equine, her special interests are, of course, geriatric care, but wellness of all horses, dentistry, and foal medicine. And then to get the foals, you have to do the reproduction. So she specializes also, well, I should say special interest. You have to be careful how you say these things in your event, in fresh, cooled, and frozen semen breeding, and then breeding management. So you can embryo flush. What important things did I miss about you?
So I have grown up with horses my whole life. Started off riding saddlebred, saddle seat, and have ventured into the stock horse world, ridden pretty much everything and anything, cutting horses, barrel racers. I've galloped thoroughbreds on the racetrack, so I've done a little bit of everything. At this point, most of my horses are retired, but they live on my farm and they're living their best life. So that's one of the reasons that I really enjoy geriatric care, because I do have to deal with that every single day in my farm, as well as the rest of my menagerie. I have a little bit of everything at home: reptiles, chickens, ducks, cats, dogs. So a little bit of everything at home, but we will focus today on the geriatric care of horses because we love our old guys. So just a quick outline. We're going to talk about what the definition is of a geriatric horse. Then we're going to go into their general health care, which includes body condition scoring and their nutrition, followed by diseases. And then, of course, we have to talk about euthanasia in regards to our old guys. So what is a geriatric horse? So a horse that's greater than 20 years of age is what we consider as geriatric. There are some studies out there that say anywhere between 15 and 20, sometimes even up to 22 years of age, it would be considered a geriatric horse. But in general, over 20 years of age is what most people consider a geriatric horse. And in the US, about anywhere between 7.5% to 20% of our equine population is considered geriatric. And this is likely because we have better care for them and they're surviving longer. We're treating these age-related changes that occur commonly in these guys with more different medications and more research every year. Interestingly, horses don't age the same as humans do. So you can see a yearling horse is about 4 years old in the human realm. So it's about a 4-to-1 ratio. As they start getting up to 15 years old, they are about 50 years old, according in human years. And then the definition for a human geriatric patient is 65 years. So as you can see, as they're approaching 20 years is when they hit that 60-year mark. And this isn't 100% accurate, but this is kind of what we base our numbers on. And then as you can see, as they get really old, 35 years, they're a 90-year-old human. So they can get pretty up there in age. So just like with all our horses, not just geriatric horses, we have to provide them general care. This includes a safe and comfortable environment, adequate feeding protocols that are catered to that individual horse, good nutrition, attention to ambient temperature, grooming care, parasite control, and then of course, dental care. So we'll start with nutrition. And the main thing with nutrition is we got to maintain a good body condition score. Horses tend to lose weight because of parasites, poor dentition, competition with pasture mates, and then of course, disease. So what is the body condition score? This is something that all veterinarians use and nutritionists use to objectively evaluate the horse's body condition. It was developed in 1983 by Dr. Heineke, and it is on a scale of 1 to 9, 1 being a very, very thin horse so that you can count all of their bones, that you can just essentially see skin stretched over their bones, they have no muscle tone. And then 9 is our very, very fat, obese horses. So this is based on the visual appraisal of 6 major points of the horse that are most responsive to changes in body fat. And here are those regions. So the first region that we look at is right behind the shoulders. The second region is over the rib cage. The third is over the tail head. Fourth is that loin region. The fifth is the withers. And then of course, lastly, the sixth is our neck crest. So here are some examples. So you can see to the left is a body condition score of a 1. You can see all of the bones on this horse. You can easily identify the ribs. You can easily see the spine. You can see that the horse is sunken in, has no neck musculature, no fat on the muscle. And then as they start getting into a body condition score of a 2, you have a little bit more fat on the muscle, on the neck region. You're starting to lose some of the concavity of that area right next to the spine. You're getting a little bit more cover over the ribs. Even the horse is starting to get a little bit of a belly here. And then as we get into the body condition score of 3, so this horse has a little bit more of a hair coat, but you can see we've got, again, more cover over that rib cage. You can see there's a lot more fat or musculature over the hindquarters. You're getting a little bit more fill in the withers, and it's hard to really tell, but the neck is starting to fill out more as well. And then again, compared to this horse, which is a body condition score of a 4. Now, granted, this particular breed of horse is always going to have a leaner neck, but you can see that there is starting to get a little bit of a pouch here on the neck. And then they've got more rib cover. They've got more fat over the tail head and more withers cover as well. Body condition score 5 is what we really like to see in our horses, especially in our performance horses, like this fit thoroughbred here. So you can't really see the ribs, but they should still be easy to palpate. They have nice rounded hindquarters, a nice filled out neck, and you can't really see where the withers are, but this would be a nice example of a body condition score of a 5. And then your body condition score of 6. So this horse is starting to get a lot more coverage over the ribs. You would have to kind of search for these ribs a little bit more, a nice thicker neck region, and then more fat over the hindquarters. Then we start getting into our fat horses. So our body condition score of 7. So you can see this horse has a little bit more of a belly. It's got some fat pads here. We probably are going to have to hunt for the ribs a little bit. And this guy is starting to get more of a cresty neck. Same thing here, body condition score of an 8. So you can't identify where the ribs would be. You got a big rounded hindquarter. You've got much more of a cresty neck. And then we get into our body condition score of 9. And that's when we really start to get a ridge down the back of the horse. You're going to have to hunt for those rib cages. You sometimes will see these fat pads. And of course, our donkeys and our ponies are more predisposed to developing these, getting too fat because they tend to live off of air in most situations. And I always tell people, you know, if water can pool on the back of your horse is probably too fat. So why is body condition important? Because most horses maintain their ability to maintain body condition and mass. And if they don't, then they're more predisposed to developing illness. So if they're too fat or too skinny, they're going to be more predisposed to developing illnesses. And the exception to horses that can maintain their body condition and mass is horses that have PPID, which we'll discuss a little bit later. So you don't really have to change a horse's core protein requirements, only with certain disease states. In our older horses, it's important that they have a well-balanced diet because they have a harder time digesting fiber. Their gut doesn't work as appropriately. So their hindgut is where horses digest their fiber. And as they age, it doesn't work as well. So they can't utilize those long stem fibers as well as they used to in most cases, like they were when they were younger. And they also have a decreased ability to manufacture and absorb vitamins such as vitamin B's and C. Our older horses also have a decrease in kidney function. So sometimes this can cause calcium stones to build up. And they also have a decrease in liver function, which can cause jaundice, weight loss, lethargy, loss of appetite, and then also an intolerance for fat and protein in their diet. So these are all things that we need to watch out for in our older horses. And then we want to think about confinement. Is confinement really appropriate for these guys? In some situations with our older guys, we do have to confine them at least to feed them. because otherwise their buddies are going to be trying to eat their food. So if we're feeding them a lot more than what their friends are eating, or if they're eating slow, then really it should be best to confine these guys and separate them from the other horses when they're being fed. But ultimately, it's best to turn these guys out with a friend, if at all possible. The movement is going to be super important for these horses, unless it's a horse that really does not do well outside, which definitely happens too. And some common weight loss reasons are poor dentition, and then a reduction in digestion. So parasites, a problem with their microbiome or their normal microbial flora in their gut, and then B vitamins can also be a contributing factor to why they are losing weight. So these are all things that we can look into. When we are selecting feed for not just our older horses, but for any horse, we want it to be highly palatable. In our older horses, it has to be easy to chew and swallow. It needs to be dust-free and clean. It needs to be highly digestible pellet or an extruded feed, especially in our really old horses. And then sometimes we need to go to chopped hays, hay cubes, pellets, things along that nature. And then sometimes even soaking feed or mashes is important with these guys. So as these guys age and they start to develop problems with their dentition, they're going to be more likely to develop things like choke. And so that's when we have to really consider soaking their feed and making sure that they don't have such long stem fibers in their diet. So that's why the companies make senior feed. It's been specially formulated for our older horses. It's also super beneficial for our starved horses. It has an increase in protein, minerals, and vitamins, and it's easy for these guys to digest. We can feed it in small quantities several times a day, 3 to 4 times is best. But ultimately, these feeds are a complete feed. So horses can live off of just a senior feed as long as they are being fed enough of it. And a complete feed is just a feed that also contains their appropriate amount of fiber in it. So it's essentially replacing the hay that would be normally in their diet. Sometimes with our older guys, we can also add corn oil for if we need it for some extra calories. Water can sometimes be overlooked, but it is super important for all body functions. And we really should temperature regulate it if at all possible. So we need to make sure that we are warming it up in the winter, especially in our cold Wisconsin winters. And water is also very important for feed digestion. So that's a lot of reasons why when we have weather changes, these guys aren't drinking as much water. We see impaction colics because they're just not digesting their feed very well. So amount of water intake is very much dependent on several factors, one of which is the level of exercise of the individual horse. So a horse that's standing around not doing much is probably not going to drink as much water as a horse that's performing. The ambient temperature of the water, again, a horse is more likely to drink water that is a little bit warmer versus water that's ice cold or has ice in it. So that's why heaters, if at all possible, are super beneficial for these guys in the winter. The type or the quality of the feeds in the ration can also be an indicator of how much water they're going to have. If they're eating something that's super dry, super dusty, they're likely going to drink more water. And then the proportion of diet that is forage is also going to affect their water intake. So horses that are eating a lot of forage, their majority of their diet is forage, especially if it's a stockier, stemmier forage, they're going to be drinking a lot more water. All horses should have a minimum of 1 gallon per 100 pounds of body weight a day. So for a 1,000-pound horse, it's about 10 gallons of water that they should be drinking a day. Of course, more is always better, especially the time of year. So in the heat of summer, they should be drinking more. Even in the winter, if possible, if we can get them to drink more, the more water they can drink, the better. Humans have anorexia of aging. So as humans get older, sometimes they don't want to eat as much. And some studies have shown that this is from loneliness and changes in sensory organs. Also, changes in hormones can be a factor in this. There hasn't really been a treatment that's been shown to be effective in humans. And we have actually seen this in horses, where our older horses become picky eaters, even if they weren't picky in the past. or, you know, they'll be eating great and then all of a sudden they'll go off of a particular feed. They'll just decide one day that they don't want to eat that whatever feed that they're eating, you know, whether it's alfalfa pellets, senior feed, whatever it may be, which can be quite frustrating for owners and veterinarians in general, because we're always wanting to make sure these guys are eating as much as possible whenever possible. So sometimes this is as simple as just switching up their diet, trying to pick something else. And sometimes they go back to eating what they were eating before, and sometimes they don't. Every horse is different. But unfortunately, there really isn't a treatment that is effective for these guys. All right, going into dentition. So as horses age, their teeth continue to erupt until a certain point. Usually about the age of 15 is when their teeth stop erupting. And what that means then is those teeth that are in their mouth are going to start wearing down. These teeth can also loosen up as well. And so our older horses can lose some of those teeth. They can get sharp edges or even a wave mouth to form. And a wave mouth a lot of times happens, or step mouth comes up when they lose their teeth and they don't have that opposite tooth to grind against. So sometimes we have to be more cognizant of those teeth and make sure that we're filing them down just a hair, just to make sure that they're not cutting into the gums. And having all these problems, whether it's loose teeth or sharp edges, can all impair their ability to chew, not only hay, but grain and pellets as well. So frequent teeth floating, or at least an oral evaluation of these guys, is super necessary. I highly encourage people to at least have their horses' mouths checked every 6 months as they get older, so that we can address any problems that they may have. The benefit to that is also we don't have to have their mouths open as long in most cases, because our older guys can get pretty sore having their mouths in a speculum for an extended period of time. So having them checked every 6 months allows us to do minor changes and get in and out of their mouths as quickly as we can. And the big thing is we cannot overfloat these horses because they only have so much tooth left and it's not going to come back. Our older groups of horses can have a variety of different dental diseases. So in this picture to the left, you can see a big ulcer, and that's because of this hook, or I'm sorry, this sharp point that's on this side of the tooth here, and that's cutting into the cheek here and causing this ulcer. This is not just an old horse problem. This can happen in any of our horses, which is why we do our dental care. But this is what can happen in our older group of horses as well. And sometimes in our older group of horses, or horses that are eating from hay nets or are known to grind their teeth against bars, can actually wear down their incisors, and you can see that they will just form these little nubbins. And then sometimes what will happen is they'll expose the roots here, and we might have to take these teeth out. So it's super important to keep a close eye on these guys as well. And then our older groups of horses can also develop what's called EOTRH, which is equine odontoclastic tooth resorptive and hypercementosis lesions. It's a mouthful. And what you can see here is these teeth can start to resorb. So you can see this kind of area, this black area where the tooth was. So this is one of the incisors, and then this black area. Or the other problem that can happen is they can form all of this extra bony tissue. And these teeth are pretty painful. Sometimes they'll be loose, but ultimately these guys will get pretty uncomfortable. And what you might see, so this is a normal horse. The gums look very normal. They're nice and smooth. As this EOTRH starts to develop, you can start to see kind of these bumps along those incisors. And then this is a very advanced EOTRH where you see a lot of change in the gums. It's very bulbous looking, very angry looking. So this can be a very significant problem. And then our old horses don't necessarily want to eat when they develop this problem because they don't want to grab things with their incisors. Here on the left, you can also see an example of some expired teeth. So they don't have the ridges anymore. So this tooth is very, very smooth compared to these teeth back here that still have some ridges. So when they get to this point, when they are smooth like this, these teeth don't have any value for grinding down any hay or forage. So that's when we have to start considering a mostly senior feed-based diet, or start considering adding the chopped forage or hay pellets, hay cubes, things like that. So treatment very much depends on the disease. In our EOTRH horses, removal of those incisors is usually what we end up recommending. Sometimes that means we remove both the top and the bottom incisors. Horses actually do really, really well after that procedure. They can still eat just fine. They will go out and they will learn how to use their lips to pull up their grass. A lot of times these horses have started already using their lips instead of their incisors to pull up grass because they didn't want to use those incisors because of the pain. And then of course, regular dentistry is super important. And then changes to the diet is also important depending on what's going on inside of the mouth. So it's always important to work with your veterinarian on what's going on inside your old horse's mouth to make sure that you are treating them appropriately. Parasite control. So fecal egg counts, even in our older groups of horses, are super important. Even if you're only doing them once a year, twice a year is always better. But we always want to be checking these guys and making sure that they're not developing a parasite resistance to our dewormers. False negatives can occur, especially with encysted strongyles, because we are not necessarily always looking for all of the parasites, and all of the parasites are not necessarily always shedding. So that's why we still deworm these guys, even if they have a low fecal or a quote unquote negative test, because we know that there's still going to be some sort of parasites there. And for all these guys, it's important to work with your veterinarian so that you can develop a program specific to your horse. So this will also help to maintain the horse's body condition. Thermoregulatory control is important because a study has found that older horses can't regulate their temperature as well as our middle-aged horses, and that they need more calories than the middle-aged horses, especially during the winter. This can be kind of challenging to do, especially those horses that don't have as good of teeth as some of our middle-aged horses or our younger horses, because we have to change their diet significantly in order to provide them those calories. In our middle-aged horses, we could just feed them more hay. In our older horses, we may have to increase their senior feed or come up with other ways to give them more calories. And then there was another study that showed that aging can also compromise thermoregulation during exercise. And so that's important to consider whenever we are exercising our horses, whether it's in winter or summer. In the winter, they're more likely to get cold faster, and in the summer, they're more likely to get too hot too fast. And then, of course, extremes in weather can impact their appetite as well. So when we had those really cold days a few weeks, well, almost a month ago now, that can certainly impact their appetite and make them lose weight. So we have to increase their calories and prepare for those types of situations. So all in all, we have to remember to keep our geriatric horses cool in the summer and warm in the winter. So this might mean that we are clipping our older horses in the summer, even if we haven't done that in the past, to help keep them cool, and then blanketing them in the winter, again, even if we haven't done that in the past, to keep them warm. Grooming is also important for temperature regulation. So daily brushing helps with the circulation. So just taking a curry comb over a horse is going to help loosen up all the dirt and debris, help prevent anything from sticking the hair down, but it's also going to help with the circulation. And this, again, is important because our older group of horses can't thermoregulate correctly. And then our older group of horses also has diseases like PPID, which is associated with hypertrichosis or a longer, thicker hair coat. So just getting rid of all of that debris and dirt can help with their temperature regulation. Immune system. So our aged horses' immune system can sometimes not be as functional as our younger horses. So this is considered immunosenescence, where it's just not as good as it used to be. And this is just because of a decline in our lymphocyte count and our B cells, which are part of our immune system, and can likely affect their response to vaccines, as well as increase their vulnerability to infection. This is why it's important that we are maintaining our vaccination schedule, even in our older horses that don't go anywhere, don't do anything, don't travel. We still need to maintain their vaccination program because those vaccines might not be as effective in them, and they are going to have an increased vulnerability to different types of infections and diseases. As they age, horses have an increase in inflammation, and if they are obese, they are worsened for this age-related disease, and they have an increased risk of inflammation. So if they are fat and old, then their inflammatory risks are much, much greater. All right, so common diseases of geriatric horses. Most of these I think you guys have all heard of. Pituitary pars intermediate dysfunction, also known as PPID or Cushing's disease, equine asthma or HEAVS, laminitis, and then of course our orthopedic diseases like arthritis. So again, PPID, it's also known as Cushing's disease. Typically we see that in horses that are greater than 15 years of age. And this is caused by a malfunction in or a microadenoma of the intermediate lobe of the pituitary gland. So it's essentially a quote unquote tumor on a portion of their brain, which is called the pituitary gland, that causes pressure on that gland and causes them to secrete excess, essentially cortisol throughout their bloodstream, which is what causes some of our clinical signs. And our clinical signs depend upon the stage of the disease. A lot of people think of Cushing's disease and they think of a horse that looks like this. And that's not always the case when we think of Cushing's disease as veterinarians. So we have the classic hypertrichosis, which is the long curly hair coat or delayed shedding. Sometimes they can have excessive hair on their face or their legs, but they can have all of these other clinical signs as well. So it can be lethargy. Our first clinical sign could be laminitis. It can have excessive sweating or random sweating in a variety of places. Repeated infections or infections that aren't healing as well or delayed healing. A potbelly appearance, muscle wasting, puffiness above the eyes, a crusty neck with or without other areas of abnormal fat deposits. I've had horses that show up with Cushing's disease that have a soft tissue injury, such as a bowed tendon, just from being outside in the field. So it can show up as a variety of different things. And we know more about it now than we did before, and we continue to learn more and more about it. And so we'll probably continue catching these guys earlier and earlier, and getting them treated earlier and earlier. The way that we diagnose them is through a blood test, and there's two different ones that we use. So the first one is just looking at their endogenous ACTH, or just resting ACTH is what that essentially means. So we pull a blood sample and check and see what their ACTH value is. Or the other test is a TRH stimulation test. So we would pull blood, same thing, pull it for the endogenous ACTH. They would get the hormone, the TRH hormone IV, and then 10 minutes later, we would draw another blood sample to check their ACTH levels again in response to that TRH. So the TRH stimulation test can only be done certain times of the year because we don't know enough about it. We don't have the correct numbers for some periods of the year. So that's why we have to kind of stick to the endogenous ACTH for a good chunk of the year, and then the TRH stimulation test for those horses that are kind of on the fence line. There's really only one treatment for Cushing's disease. It's called Presend. And depending on the horse's size and the value, it typically starts at about 0.5 milligram to 1 milligram, which is a half tablet to 1 tablet a day. This medication works really well to help maintain these guys. Sometimes we do have to adjust their dosages as they continue to age and as the disease continues to advance. But most horses in general tend to do well on that 0.5 to 1 milligram a day. So this medication is in prepackaged little individual foil packaging. And I always tell people it's super important that we don't open those tablets until we absolutely need them, because this medication is super sensitive to getting exposed to air. And that's why it is packaged in those individual foil packets, because of their special packaging process. It's getting rid of all the air inside the packaging to help preserve the medication. So don't get all of these ready for a month. Don't take them out of the package. Really try to keep it in the package until you need it, until you're ready to feed it. If you're using that 1/2 of a tablet, I always end up putting it back into the package and putting the package back into the box, or putting it in the Ziploc baggie, just to help minimize the amount of air that gets in there. The company does say, you know, as long as you're getting it into the animal within a week, then you're probably still okay. But after that week time frame, it definitely significantly decreases in efficacy. Equine asthma, also known as recurrent airway obstruction or HEAVS, it's similar to human asthma. We see it a lot in horses that are greater than 9 years of age, and typically between 9 to 12 years of age. We see it frequently in horses that are stalled a lot or are fed round bales, but it can happen in just about any horse. Most of the time, we see it exacerbated in either the winter or the spring when the seasons are changing. And there is no breed or gender predilection. Any horse can get it. So this is diagnosed based on their history, their clinical signs. So history meaning, you know, have they been coughing? Have they been coughing? Oops, sorry about that. For an extended period of time. And again, their clinical signs, you know, how are they breathing? Are their nostrils flaring? What's their respiratory rate? How do their lungs sound? A lot of times these horses will have wheezes on their lungs. Some horses can develop what's called a heave line or a muscle that's on their belly that is actually exacerbated because of them having to constantly have to breathe heavy. But ultimately, we diagnose them on a BAL or a bronchoalveolar lavage, where we pass a tube up their nose, down into their lungs. We put a little bit of fluid in there. We collect that fluid back, and then we submit that fluid for analysis. And we look for a presence of a specific white blood cell, and that's a neutrophil. So the neutrophil is there because of inflammation. If there's a greater than 25% neutrophil population in that sample, then that's a confirmed HEAVS case. How do we treat these guys? So the big one is environmental management. So getting them off of the round bale if at all possible, wetting down their hay, getting them a pelleted feed because those usually tend to be a lot less dusty than our hays. Sometimes we can even get a hay steamer to help get rid of the dust and mold. No matter what we do as far as the hay baling process, there's always going to be dust and mold in the hay. Even the best, absolute best hay is going to have some sort of dust and mold with the baling and the storage process. So that's why that's the first thing that we look into. And then trying to get these guys out on the pasture instead of having them in a stall, you know, keeping them, if they have to be in the stall, making sure that we're improving their ventilation as much as possible, keeping them in a stall that's close to the end, and then making sure that they're not inside when stalls are being cleaned, any stalls inside the barn, not inside when the stall aisles are being swept or blown or whatever it may be, anything that's going to cause extra dust, we try to get them out of those situations. And then after that, we start to consider corticosteroids or bronchodilators, which are medications that can help with these guys. So the bronchodilators are going to open up their airways, and the corticosteroids are going to help decrease inflammation. And there are several different ways that we can get that into these guys. So we can nebulize them. So that's this horse down here. It's got a nice blue nebulizer on him. And what's nice about the nebulizer, most horses tolerate this really, really well. Once they get adjusted to it, it makes very little noise, and they just kind of wear it, and they're breathing in and out until all the medication goes into their lungs. Other things are an inhaler, so like this Aerohippus inhaler, so that goes on one nostril, and then the inhaler goes into this little port here. There's a one-way valve, and so you put all of your medication into this chamber, and then you just hold that on the horse's nose until he takes about 5 to 10 breaths so that you get all of that medication in there. So doing the inhaler doesn't get as much of the medication into the horse as the nebulizer does, which is why we try to do the nebulizer if at all possible. And then, of course, there's parenteral things that we can do, things like dexamethasone, which is a steroid, and then our albuterol or clenbuterol, syrup, which is things like this ventipulmin to help as a bronchodilator to help open up that airway. And again, the big thing is management changes. We try to manage these guys as best as we can with just changing their environment as best as we possibly can. tends to be harder in boarding environments versus if you have the horses at home, because you can do things a little bit differently at home. A lot of boarding facilities will also work with you as best as they can because they also want the horse to succeed. But you know, they can only make so many changes as well. So we have to do our best to try to make the changes necessary for these guys. But our ultimate goal is to decrease the exposure to allergens. So once we figure out what the horse's trigger is, we can try to decrease their exposure to that particular trigger and help keep them at bay. You know, anytime a horse ends up having a flare, they're developing scar tissue in their lungs. So the longer that they have that flare, or the more frequently they're having flares, the more scar tissue they're forming, and the harder it's going to be to maintain maintain it and control it. I always try to tell people to keep a diary of what's going on, and that's super helpful to know what is causing or what is potentially triggering these guys for their heaves episodes. And then also knowing, you know, ultimately how they're doing, because sometimes we can get a little bit blind in how they're doing. So if we have to actually write things down or look at a calendar, sometimes that can keep us a little bit more honest. All right, so then we'll start talking about laminitis, and this is not just an old horse disease. This can happen in any horse. I've seen it in as young of a horse as a yearling, so it can happen in any horse. And there's two different images here. So the image on the left you can see is a horse that has evidence of laminitis. You can see that the hoof wall is very much dished. There's changes to the tip of this coffin bone here, and there's obvious rotation happening, versus this horse on the right that does not have any rotation happening. And this horse, this picture up in the upper right-hand corner, is a classic laminitis stance. So you can see that the horse is shifting back, trying to sit all of its weight on its hind legs and trying to take the pressure off of its front feet. There's a lot of research on laminitis, and there's still a lot of unknowns about laminitis. So we really don't have a clear mechanism. We don't really know why it happens necessarily. We have a lot of suspicions. We know that it's an inflammation of the lamina, which is the soft tissue structures that attach the hoof wall to the coffin bone in the foot. That is, you know, the predisposing or predominant factor in laminitis, but we don't necessarily always know what causes it. So underlying conditions such as hyperinsulinemia can be a contributing factor. Horses that have PPID, you know, there's horses that get into grain or get grain overload when they're not used to it. You know, horses can develop laminitis from standing on one leg for an extended period of time. If anybody remembers Barbaro, that's what happened with him after his surgery because he had to put too much weight on the other leg. So there's a lot of reasons that laminitis can happen. And a lot of times we don't necessarily know why, and it can be a very frustrating disease because it can be a chronic reoccurrence once it's happened once. So clinical signs, so lameness is the most common one, of course. That horse that, like I said, I showed you guys that picture of is a pretty classic example, but they're not always that classic. Sometimes it's just they're really tender, kind of walking on eggshells, especially when they're turning. They don't really want to turn very well, or they don't like to turn, or they'll be super painful when they're turning. Uptundation or just kind of dull demeanor. They don't really want to do anything. They don't want to move around their stall. They don't have the same personality that they used to. Anorexia or decreased appetite. They don't want to lift their feet. So maybe when your farrier comes, they're really not wanting to lift their feet. And then of course also increased digital pulses because there's a lot of blood flow going to the feet trying to help or trying to decrease the inflammation. We diagnose these guys with a thorough physical examination. We then always want to put in or examine the foot and put hoof testers on the foot to see if they are sensitive over the toes. Sometimes this can be a lot more difficult to do than we would think, especially in that first horse that I showed you guys, because that horse is most likely not going to want to put weight on the other leg. And then radiographs are super important for these horses so that we know where they're at. Even if this is their first bout of laminitis, radiographs can be super beneficial so that we have a starting point to know where this horse started. Does it have any changes? Doesn't have any rotation? And we can go from there. And then venograms are also done with radiographs, so we know how much blood flow the horse has to the foot, and this can also be a good prognostic indicator for us when we're deciding treatment options. So what ends up happening with the venogram is we still take x-rays similar like we would do just with regular x-rays, but we actually put a dye directly into one of the blood vessels that goes into the foot, and we assess how much blood supply that horse has. So if the horse has a lot of rotation in the foot, he's likely going to have some cut off blood supply, and that is a poor prognostic indicator, and it may change the way that we treat that horse. Treatment, so we're always going to have some supportive care. We want to have super deep bedding. We want to pad up their feet as best as possible. Soft rides can be super beneficial for a lot of these horses. Pain medications are key to try to get these guys under control and try to reduce some of the inflammation that they have. Icing the feet can be beneficial as well. The downside with icing the feet, though, is that it has to be done consistently. It can't just be done off and on, because that can actually cause more damage than good. So sometimes I've had people, if there's a lot of snow outside, if we can get the horse outside, we'll have them stand in snow for a couple of days. But again, we have to kind of keep moving them around, and the snow has to be quite deep in order for that to work. So a lot of times the icing of the feet only happens if they're in a hospital type situation to help decrease that inflammation. So at home, you're ending up doing some supportive care, deep bedding, bringing the food to them, making sure that they're still wanting to eat and drink, pain medications, and trying to pack their feet or put some soft rides on them to help support their feet. And then ultimately, we want to try to figure out what the primary cause of the laminitis was and treat that primary cause. So if it was a grain overload, we probably aren't going to do a whole lot. We're just going to try to support those horses. But if it's a horse that has PPID or hyperinsulinemia, then we want to be able to treat those guys to try to get some of that factor out of the equation so that they don't happen again. The farrier is going to be super important for these guys, especially when they have chronic disease. So we're going to end up having to trim them appropriately and sometimes even put on special shoes to help support these horses so that they can become more comfortable. And then there are salvage procedures such as cutting the deep digital flexor tendon, and that will help to relieve some of that pressure on that coffin bone, because the deep digital flexor tendon attaches to the coffin bone and it's just going to keep tugging on it and causing more rotation. So sometimes we can cut that tendon to help make that horse more comfortable. These horses most likely will not become performance horses once they have the deep digital flexor tendon cut. That is a salvage procedure, so at least that they will be happy to be living out in a field. And then ultimately, sometimes we do end up in euthanasia for the benefit of the horse. All right, so let's go on to talk about orthopedic diseases, also known as arthritis. So things that can be a sign that a horse has some orthopedic diseases can be loss of appetite. This can be a representative of pain. Some horses can be uncomfortable grazing. This is if they have arthritis in their neck or sometimes in their forelimbs. They might have a decreased desire to move around or ambulate. They might have decrease in their grass consumption or any kind of feed consumption. And really pain management is critical, and potentially we have to figure out how to feed these guys to make them more comfortable so that they will continue to eat. So sometimes that means raising their feed so that their head does not have to be as low. So things like putting the feeder on the fence or attaching it somehow up higher in the stall, feeding from a raised bucket, like I said, or having a large whole hay net so they don't have to get the hay off of the ground. And then again, pain management is super important for these guys. So anti-inflammatories and other types of pain management. We want to make sure that we have level ground or fields for our older horses, because as they continue to age, they're going to develop more arthritis, which is going to make it difficult for them to move around, especially up and down hills. Or right now when the ground is frozen and all rutted, that's going to make it more difficult for some of our older groups of horses. So we want to try to keep the fields as flat and level as possible. The location of their water, feed, and shelter should be in close proximity to each other. And this is so these guys don't have to really move around. We don't want to make them move as too much because it's not beneficial for their arthritis. And we still want them to be able to get out of the elements. We want them to be able to get access to their food and water. And then really important is to make sure that there isn't any bullying happening. So if you notice that your horse is getting picked on by an older horse or another horse, then you should really probably consider moving them to a different field or finding them a different buddy or moving the bully out of the way so that these guys aren't getting run around again, especially in the winter months when we have ice or uneven ground. These guys are more likely to fall and have troubles getting up or fall and really get themselves hurt. All right, saying goodbye. It's always a very, very tough decision, and sometimes it's made for you, but a lot of times it's not. I know a lot of people always want, to just find that horse deceased one day, just fall asleep and not wake up. But a lot of times we have to make that tough decision. And it's all based on the quality of life. And I always tell people that we are much kinder to our animals than we are to people because we are blessed to be able to relieve pain and suffering from these guys. So that, and even though it's hard, that is something that we need to keep in mind. And there are a couple of considerations from the AAP, the American Association of Equine Practitioners. These are all guidelines for euthanasia. So a horse should not have to endure continuous or unmanageable pain from a chronic or incurable disease. Horses should not have to endure a medical or surgical condition that has a hopeless chance of survival. A horse should not have to remain alive if it has an unmanageable medical condition that renders it a hazard to itself or its handlers. And a horse should not have to receive continuous analgesic medication for the relief of pain for the rest of its life. So all of these things are something to consider in our older groups of horses because, again, ultimately, sometimes we have to make that decision to end their suffering or prevent further suffering. And if we are noticing that these guys are having more bad days than good, then we need to start considering those things. And this is where that diary or that calendar comes into play again, is start recording, how many days your horse is having a good day and how many days your horse is having a bad day. You don't want to wait until they're not eating and losing weight or they're down in the field on the ice. You want to make that decision on a good day. I always want to make that decision. I always tell people I would rather make that decision a minute too soon than an hour too late because I never want a horse to suffer. So on that sad note, we'll have a look at this cute foal and any questions.
Yeah, just type your questions in the chat if you have any. In the meantime, I'm going to ask my questions. So first of all, that was an excellent. You covered a ton of stuff. That was the most comprehensive geriatric talk I think I've ever heard. So congratulations. You put a lot of work into that. I wrote down your last sentence about the euthanasia, that you'd rather be a minute too early than an hour too late. I think I may have to use that.
I use it all the time because it's hard, it's hard making that decision. It's hard for me to, I'm a human being too. And when it comes to my animals, I have a hard time with it too. And I just have to keep in mind, I'd much rather end it too soon than too late.
Yeah. Well, and someone told me that, think about, euthanasia means good death, and think about how you'd like your last memory of your horse to be. Do you want it?
Yeah.
I chose with mine, it was a bright, sunny, 70-degree June day.
Yep.
And it was just the most perfect day for the most awful day of my,
Yeah.
But I would rather have done that than it be an icy, cold, winter, blizzardy, yucky, gross day, and he was down.
Yeah.
That's
and I think
awful.
the other thing is the guilt factor. We don't want to feel guilty for making that decision. And you have to be, you know, as an owner, you have to be okay with the decision that you make. And you should never feel guilty for making the decision.
That's good. So we do have a question. Does steaming hay help horses with poor dentition?
So it usually does not help horses with poor dentition, because all it's doing is it's going to make it a little bit softer, but it's just taking away the mold and the dust that's in it. It's not really going to make it easier for them to digest, because even if it's soft, those horses aren't going to be able to break it down into a small enough fiber in order to really digest it. Good question.
I wanted to go back to the part where I was really glad to see you included the part about older horses becoming finicky eaters,
Mhm.
picky eaters.
Yeah.
And we had a barn full of older horses, and we would just get one to eat a brand of grain, and then another one would go, nah, today, Wednesday, it's not day. I don't like that brand anymore.
Yeah.
So we had 3 horses, and we had about 9 different kinds of grain in
Yep.
and it about every 3 weeks, maybe a month, we had to rotate.
Mhm.
And then they were all like, oh, this one's good. Like, you've had that one 6
Yeah,
times this year
exactly.
already. Yeah.
Yeah.
But then we did, so I want to ask you, what other things besides just changing grains have you or your clients tried?
Yeah, so the changing grains is the big one, and sometimes we've even mixed multiple different types of grains together to try to encourage them to eat. I've had people put things on top of the grains, things like corn oil or molasses. Some people swear by putting aloe vera juice on it. They say that their horses eat it really well. You know, adding flax or something like that to their diet sometimes encourages them to eat. We have a mill around here that makes a product called Walkie Bulky. People swear by that it makes
Wait. It's called what?
Walkie Bulky.
How do you spell that?
Excellent question. I'm not sure. I think it's WAUKE. It used to be made by a local mill called Walkie Mills. They have since shut down, and now Merton Feed Company makes it. People swear by it. I have absolutely no idea what's in it. I know it's a chopped forage. It smells sweet like molasses, but I can't actually tell you what's in it because I don't know. But people around here swear that helps horses eat.
That's a good point, though. The Triple Crown chopped forage smells amazing. So we've
Mhm.
tried that. We use beet pulp. At one point, she even crushed peppermint and
Yep.
sprinkled it on top.
Yep, I've had people do that. I've had people put peppermint schnapps
Oh,
in their horses' feed, or peppermint extract or vanilla extract. Yeah,
well, you know what? They really like beer, and
Yep.
I fed my horse beer for a number of reasons. May as well, time to crack open the Guinness.
Yep. Yeah. So I've had people try all kinds of things, and every horse is different.
Yeah.
I've had some people put horses on GastroGuard, and that seemed to help. Whether or not they actually had ulcers, I can't really say because we didn't scope those horses, or was it just a time thing and the horse decided that it was going to eat again? It's hard to say, but every horse is different, and it can be super, super frustrating because you end up with 27 bags of different types of feed, and you're just mixing concoctions together. And sometimes what I'll do is I'll just offer the horse a smorgasbord. So the horse will have 6 or 7 buckets of feed in their stall. And I'm like, okay, you eat what you want.
Yeah. Eat something. Yeah.
Yeah.
They're usually trying to get some medication or supplements or just calories
right
into them. Like you
Yeah.
gotta eat. Gotta eat.
Yeah.
Well, good. Okay.
Yeah.
I don't see any more questions. I think people are they're like, that was a lot of information to take in. They have to noodle on it
You have to
overnight. So-
digest it.
but this
Yes,
was
I tried to
excellent.
cover as much as I could, but
You
not
did it.
be overwhelming.
Well, and it's nice because it's recorded, and so they can go back and watch it again if there were parts. Because I know some in like the PPID section, that was a lot of technical information to get down. So
Yeah.
but this was really good. Thank you so much.
Yeah.
Hopefully everyone is prepared for the snow that may or may not be coming. we're just a little bit before 8, but I think if everybody's content, then I guess we'll call it evening and we'll go relax.
All right. Well, you guys have a good night. and
Margaret,
stay
thank you
safe.
so much for your time.
Yeah.
Yeah, thank you so much for your time. We really appreciate your presentation. And since I have a geriatric horse, I learned a lot about things I should be doing. So thank you again.
Yeah, you're welcome.
All
Good
right.
night,
Bye-bye.
everyone.